Marguerite, you've been so patient.
Did you call on me?
I did.
How are you doing, Jim?
I'm doing very well, thanks. How are you?
I'm good.
Good, good. Good to see you.
Lots of questions for you.
Oh, shoot.
Um, I kind of I try to go fast here. So I have a lot of fear, health anxiety, and that kind of stuff. Really around my lady parts, and I've been despite being on high doses of medication, I'm having breakthrough bleeding, heavy periods, and that just sends me into just woo. Um, and I read a little bit in the frequently asked questions. And so, long story short, I've been checked out for everything
Good.
constantly. I
Yeah.
hadn't been to a doctor in 4 years since I've been at anxiety center. I don't advise that.
Yeah, I
Um,
agree.
but anyway, so my OBGYN, first of all, none of them think I'm in perimenopause. My OBGYN, she's like, yep, this is just you. Deal with it, ablation, hysterectomy.
Mm,
But don't decide now. Calm down, which I thought that was kind of sweet.
mm.
My family doctor has a different take on it. He would have more of a similar message that you would have. Marguerite, you get yourself stressed out, you go into hormonal chaos, and
Yeah.
you do this. Calm down, it'll get better. What would
Okay.
you tell me?
I would say the same thing. I've seen this a lot with women. Stress can
It's hard
really,
not to panic when you look in the toilet and it's like,
uh, yeah,
and I have so much PTSD from that, like from stuff as a kid, miscarriage, so much PTSD around all that.
yeah, yeah.
I
And of
am
course,
on one, I should include this. It's not fair to say. I am on one ovary. My one ovary, it's real small and doesn't function
mm,
and hasn't for I don't know when.
okay. Yeah, 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 yeah. Yeah, I would suggest, really working at and getting your stress down, in a different conversation. I'd like to chat with you about why your stress is still up the way it is. Because you've been working for a while. So I'd like to know what some of the things are going on that's preventing for you to get to that full recovery place. But getting stressed down can make a world of difference for females. And, don't tell me your age, but as you near menopause, of course, the body's hormones are going to be all over the map anyway. So that
They
can also
don't
be a
think I've
factor.
even started. I've been to three doctors and all of them don't think I've even started.
Okay. So then that's not a factor as far as they know. I've also heard the case where people have been said it hasn't been a factor that it has been. So this is where you have to monitor yourself. But if you get your stress down, your body should behave normally. It's like when people say, well, I had this real medical condition. What am I supposed to do with my anxiety? How do I tell the difference between anxiety symptoms and my medical condition symptoms? And a lot of times what Sherry will tell them is, let's just get the stress down first. As your stress starts to come down, you'll know what the difference is. As your stress symptoms start to subside, you'll see what symptoms are left. Then you can identify those as medical condition only. And so working at stress reduction, which requires containment rather than running down oh my gosh, is this or this, or am I in trouble? Or, this is where you have to contain. If you have a good medical evaluation, and you can feel, confident that there isn't a
A
medical thing
doctor's
going
like,
on.
you can lose a lot of blood, Marguerite. Think about people that give blood. I'm like, actually, I have to tell you, he's been pretty sweet about this.
Oh, good. Yeah. Well, then you can trust your doctor's opinion and put all the other negative things out of your mind, focus on stress reduction, get your body back on track. And then you can see, if there's a medical condition or not. Because doctors, you've been in the medical field, you just know a lot of times there is some guesswork, right? And they're not going to be 100% sure in a lot of cases. So the best you can do is rule out what you can by getting stress down and then see what your body's doing after that.
Okay, thank you. That was something you brought up. I've been at it. I'm 3.5 years with you, Jim.
Mm-hmm. Yep.
I have seen stress reduction, or I have seen symptom reduction.
Yep.
What do I tell myself, when I'm in Groundhog Day?
Yeah.
for the 1500th day.
Yeah.
What do I tell myself? Like, what do
Uh,
I?
I would be drilling down. All right, where is the stress? At 3.5 years, you've been working on stress reduction. You should see significant symptom reduction, if not elimination, by now. So if that's not the case, what's going on? Where is the stressors coming from? And that would be the first question. Where is it coming from? Is it coming from unaddressed underlying factors? Is it coming from a life circumstance? With women, is it coming from menopause? Because hormones go all over the map at that time. So you want to identify the source of stress. Because if you're working faithfully at stress reduction and you're giving your body time, which you have, you should be almost symptom free, if not symptom free by now. So that means there is some underlying factors or stressors going on that's keeping your stress elevated, that's keeping your body symptomatic.
Well, I started therapy with my husband.
Hmm. That helps if that's a source of stress. Yeah.
Oh, huge source of stress.
Yeah.
Stuff
Yeah.
with my kids. I talked about this the other day with Janice. It fucking sucks being in my house every day for 3.5 years. And like, no one
Yeah.
has checked on me.
Hmm.
And I have my family, like, no one. And, I've always been there for people. And I've always, and
Yeah.
that's upsetting.
Totally. Yeah.
Pisses me off.
I want to hug
Yeah.
her.
Yeah. I think we all
Like,
do. I
it
mean,
pisses me off. And then it's like, what did those relationships mean more to me than they meant to them? I mean, in their defense, I mean, unless you've lived this hell, you you can't imagine, a person cannot imagine this, how awful this
yeah.
is. And my symptoms are way down. I mean, they
Good
are
for
down.
you. Yeah.
Um, but I know forgiveness. I'm having a hard time even wanting to make friends because it's like
Yeah.
I don't want to get hurt no more.
Yeah.
Um, which isolation is the bedrock, I mean, of anxiety and addiction and everything else. So, um,
Yeah. We were made for a relationship. We need them. They're important to us and we need to feel valued. And so if that's a source of stress, which it sounds like it is, then that would be the area of focus too. So how does that change for you? I mean, it's good that your husband's now going to therapy. That's great. Hopefully, good things will come from that. But there's other things, that we can do to find that connectedness. And I'm sure you've talked about this with Stacy, probably at, a long time, but that's the thing we need to do is look at our relationships because again, it is sensitive for you. I understand when people don't call on you. Well, that was me.
Yeah.
Most people just sort of not only did they not call on me, they berated me for not being social. Like, what's wrong with you? Suck it up, all these kind of things. It's hard when you're struggling, your body's like all over the map. So
Yeah.
there is a pain there. So it would be, in terms of therapy, it would be good to consider, all right, so what's going on in my relationships? What underlying factors are there? What attachment styles do I have? Where are my boundaries?
well, I
All
think
those things.
with Patty, talk not to throw Patty under the bus, but
It's
you know,
okay.
always being responsible, always, just having these one-sided relationships that maybe I wasn't aware of.
That's how I feel. It's because my friends all just dropped away.
Yeah.
And I still text them and ask them how they're doing. But even in those texts, do they not ask me, how are you?
I know, Patty.
Yeah.
And
I
it
fucking
sucks.
know. It
It
They don't want to go
sucks.
sucks
there.
so
They don't want to
bad.
hear it. They don't want to hear it.
Yeah.
But
Or
you
they're
know what? It doesn't matter what they want to hear. What matters is, can't someone just say, like my daughter, we text every day. And the very first thing she says to me is, how are you doing?
Mm.
And and I think that's because it's a learned thing for my children to say to people, how are you doing? Yes, thank you, please, you're welcome, all of it. And just to say, like when I send Janice a text, what's the first thing I say to Janice? Not, are you dizzy today? I say, hi, how are you? Because I genuinely want to know how she is, not about her dizziness or whatever, just how is she in general?
Patty, like this is so, and that's what I wanted. Something wrong because like my family, my husband of 20 years doesn't even know I have cystic breast. He doesn't even
What?
know, like he doesn't even know like my health stuff. Like I'm not. I'm living
Join the club.
like, and it's not just him. I mean, so part of it's me too. You know, like no one knows like what I've been going through. No one knows like.
So you're basically handling this all on your own, which is a massive stressor.
It's been my whole life, you know.
I was just going to
how
say,
does
brings back
Tim,
a lot of childhood. Yeah.
how
Being on
does
your
Tim
own.
not know, you know?
But at
Yeah.
least people can say to other people because it's proper, it's the right thing to do. It's like being kind to somebody who needs help. Just do it. It doesn't cost you anything to be kind to someone. It doesn't cost anyone anything to say, Marguerite, how are you doing? Doesn't mean you have to say I'm feeling like garbage.
Yeah, because Patty, sometimes when you message me that, I always think, I don't want to go there, so I'll just say, well,
No, that's not
I
why
went
I'm
to.
doing it.
I know, and I always message you back, and sometimes I'll say, well, I went to Walmart today, and
Yeah, she gives me
I'm
this whole
thinking,
agenda that she does.
I'm thinking to myself, what the hell are you saying? Yeah, it's the same
No,
thing.
I mean, I'm just asking you, how are you?
No,
Like,
no, and
oh,
sometimes
how
I'll
are
put
you? Oh, I'm doing
same.
okay.
Sometimes I just put same on there or something, as I don't want to. I just don't want to get into what my
she's
24/7
afraid.
The thing
issue is
like
every
I've
day.
never
Right.
gotten into any of this with anybody. Like I've never, even about past. Like there's something wrong with that. I don't know what, but there's something off about
Marguerite, it's the same. I mean, I would say everybody in all the groups has the same. 90% of them say the same thing you say about family members and friends. And I have a best friend since I was 15 years old, lives around the corner from me now and everything, but it's like we talk every day. Did she ever, get into anything about, my issues or anything? And when she did, it was like I had to explaining it all to her just doesn't click. Well, if you're having on this and now you don't take care of your mom anymore, I think you should be much better. Or my son will say, well, Mom, I thought when y'all moved into the new house it would all be better now and you'd be okay. And I'm thinking,
that's just geography.
What? You don't, and I try to explain to them about the whole process of anxiety and how you do it yourself. And my best friend, she wants to go into the spiritual part of it. Go, well, you need to just rebuke the devil, and you need to,
I've had that.
And it's like, it's not there. I said her name. Now she can't listen to the. I said, you don't understand, and I'll keep explaining it to her, and then I finally just say, you know what, I can't let this stress me because I am trying to de-stress every day. And I'm going to say, I said to her, I said, you know what? It doesn't matter if you understand. I don't really care. It doesn't matter if you understand what I'm saying or this discussion. I said, it's okay. I'm okay with that. It's all right. Because I am trying to de-stress.
I also get really panicky when I talk about and tell people about my health problems and different things. And so I just kind of keep it all to myself. And
because I think that
and I can't, and even in the past, even before the hyperstimulation, like I said, Tim didn't know. He's like, oh, you have, cystic breast. It was like, well, yeah, babe. That's why I never do a self-exam because that's always positive. So I just do the mammograms, and anyway, I don't talk about so I'm in Overeaters Anonymous, and my sponsor, God bless my sponsor, but that was one of the big things that she started. She's like, you don't talk, Marguerite. You're going to have to start talking. If you're going to have to start talking. You're just going to have to. And so the other day I was with her and I said, and now you can't shut me up.
But see, that's
Jen,
okay.
But why? So what is
otherwise.
that about? Is that from my childhood, just being totally abused, totally ignored? I mean, is that?
Yeah, you're not feeling safe. Yeah, totally.
Big part of it. That's my issue. But
Yeah.
Jim says to give grace to the people who don't understand.
Speaking of
Like,
that, Jim,
who
I
get
mailed you
mad at
something. Did you get it?
who get mad at
Are you
you
talking
because
about
you're
the
not.
placards you sent me? Yes, I did. They're
I
sitting on my
sent those
shelf.
to, huh?
Yeah,
What'd
they're
you
sitting on
say?
my shelf. They're sitting on my shelf.
No, they aren't. Are they really?
Yeah, they are. I'd go get them, but they're in a different location.
So I was feeling really crummy and I sent those to Janice. Jim says, keep calm and contain
Yeah,
on.
that's right. Yeah.
I sent it to Stacy too. I saw your address on the bottom of the newsletter and I was like, anyway, so Janice and I have those.
Oh, nice. Yes.
Yeah.
I wanted to say, first off, we want to recognize that our condition can burn others out. They don't know how to help us. We
That's
struggle
right.
for a long time and they just get burned out. They just
They
can't
get
take it
tired of
anymore.
it.
Yeah. So if we see loved ones pulling away, it's often because they don't know what to do and
Well, my
they
loved
feel
ones were
helpless.
never involved. They were
Yeah.
just like MIA. Everyone's been MIA.
The other thing too, with anxious people, we often get into lopsided relationships, and those lopsided relationships catch up to us in time. And what that means is anxious people are typically highly empathetic, so
Very
they
much.
will be the one people go to. But when you're looking for that support coming back to you, you don't get it because those
No.
aren't the people in your life. So that's kind of an expectation. It's hard to take. This is why it's important to cultivate relationships outside of our loved ones who are supposed to be doing that, who actually do care about us. And oftentimes you'll find those in support groups of other empathetic people who are struggling. Church
Yeah,
groups are great for that. Social groups where you have a common interest are great for that too, because you will find those important relationships. Is it realistic for us to expect our loved ones to treat us the way we want?
no.
Not when we get into unhealthy relationships. Not, and we get into healthy relationships because we have underlying factors that motivate us to pick the wrong people. Yeah. Now there are brave souls who realize that and who are willing to confront their spouse or loved ones. And if changes aren't made, then they make important changes themselves. We don't recommend that. We prefer that people stay together and work through that. But the other thing too is, should we sacrifice our entire lives for someone who really doesn't care that much about us? That's the hard truth. As you know, I'm divorced years ago, married a wonderful woman. I would recommend that in every degree in that instance. I was divorced because there were some things that my spouse at the time was not willing to address, still hasn't in her entire, we're still good friends, but still hasn't her entire lives. And I would have lived a miserable, awful, stress-filled life had I not made that important change. Again, I don't recommend that. I recommend that couples work with their loved ones to work through those issues. But if you have loved ones who aren't willing to do the work, it's never going to change. And you cannot be the one who's trying to uh, be responsible for 100% of that relationship, because in a relationship, each party is responsible for their half.
Right.
And yeah, and if we don't have that coming our way, it can be a lonely life. So you can stay in the relationship and then find true friends or whatever. But we all need to be connected to people. We were made for a relationship. And if we don't have those relationships, we are going to struggle. And so if we're in relationships that are lopsided, finding other relationships that can meet those needs is really helpful. And again, I'm not suggesting going outside of the marriage bond, but good friends, those kind of things can certainly help fill those gaps.
But so, Jim, what happens is eventually, I think, with most people, is friends will call and they'll call and, you're good friends and everything through the years. This is what I hear from people. And then every time they don't want to, oh, I don't want to get out. I don't feel good. Or, because of the anxiety, because of the symptoms, dizziness or whatever symptom they have, they're fearful of going to restaurants or parties. And eventually these friends will start to stop calling. And this is
Yep.
what I hear from people. And then they don't come around anymore. This is so common.
And
then
I think that's not a real friend.
you end up with no friends. And
Yep.
so this is the question, with getting out with your symptoms and, doing exposure and whatever.
I'm glad you brought that up because that was my second
Yeah,
question.
that was the question I wanted to ask about
The
exposure.
morning anxiety, as the day. So, okay. So what I've been doing is,
Ouch.
I I kind of get up for it takes me a while to get out of bed, and I kind of get up for a little bit, and sometimes I can stay up for a little bit, but a lot of times I go lay back down. Should I try to start pushing it? I mean, my heart's going, doing all the stuff, right? And I just go lay down and just ride her out. Should I start just trying to say, okay, this is symptoms. Let's just go ahead and brush our teeth, do the things we need to do. Just these will pass, but just keep like, I don't know. How do you? I mean, there was a time when I just couldn't stay up. My
Yeah.
symptoms were so bad, I just had to go lay down and just try to, you
Yeah.
know.
Yeah. I would try to live as normal life as possible with the symptoms as they are. Take them along as unwanted friends, if you like. Uh, do the best you can, but making sure you're erring on the side of giving your body sufficient rest. We don't want to just push, 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 push because that keeps the body stressed. So we want to find that balance of, trying to live the life the best you can, and then make sure you're erring on the side of giving your body sufficient rest. Yeah.
That's the question I wanted to ask you. That was my main question. Is
And my other question, I had one
go
more
ahead,
question,
Margaret. I'm
Janice.
sorry, I didn't mean to interrupt you.
The PTSD from my battery's going to die, you guys. Sorry. The PTSD from all like sometimes I have a lot of PTSD from like I had a bout of nystagmus for 15 minutes, had to go to the hospital by ambulance,
Yeah.
which they kicked me out the door with some meclizine and were like,
Looks like we lost her.
That's
not having a heart attack.
Oh.
Trigger.
And then,
No,
oh, sorry.
no.
And then, okay. So the PTSD from the symptoms and that threat kind of wants to come. Well, how bad is it going to get? Or what if that happens again? I mean, do you just contain that too? Or what do you?
Yep. You have to work through, because when we struggle for a long time, we are going to have a lot of external triggers, like all those fears sources, right? Like what happens if this happens here, and what happens if that happens there? And oh my gosh, I had this bad thing here, and all those memories are going to be there. Part of the fear extinguishing process is working through that, containing and reassuring yourself, because you really want to teach the brain, all right, we're going to be okay here. If things get really bad, what are my options? Well, I can always call for help, right? Or I can always run myself to the merge or whatever it is. Have options that you can use in those situations, but you do want to be working at extinguishing those fears, because we don't get through those fears unless we work at extinguishing them. That's just how it is, because the brain is going to remind us in those negative places that there was a danger there. It's going to do that. That's part of the survival mechanism. This is where we have to retrain it to say, no, not in any danger here. Yeah, I've had this symptom before, like dizziness. Yeah, I've had this symptom before and it was quite severe, but if I just give myself, some time and settle, it'll ease off a little bit. And so we just continue to reinforce
back pain too. I don't know if anybody had that. Do you have a lot of people talk about that?
Do. Yeah, we do. Yeah. Yeah. And pain's in all over the place. And of course, pain is a stressor too. So we want to manage that pain. And sometimes people need to use pain meds to manage that pain if the body's not responding. So,
I took so much Advil and Tylenol, but it really didn't even help a whole lot.
Yeah. Yeah. My wife has a permanent back injury from a failed dissection. And so she takes Tylenol 3s when it's really bad. She's a real trooper. She manages it, as best she can until it's, severe, and then she takes that. But some people do need pain meds just to get the edge off so that he can rest. Because if you're just going to endure the pain, well, that pain is just stressing the body, right? So
my pain's a lot better. It's a lot better. I mean, this whole period thing kind of kicked it up, and I was able to say, you know what this is. You know what this is.
Yeah, that's good. Yeah, and of course, we want to be active in terms of mobile so that the body doesn't get to a place where it's losing muscle tone, right?
That's what the physical therapist said. He goes, no matter how bad you hurt, because he was helping me, especially a few years ago when it was severe. He's like, no matter, you got to keep moving, Marguerite. You got to keep moving.
That's my problem. I don't move enough.
Yeah. Exercises. That's why we recommend, mild to moderate exercise daily, because it keeps the muscles toned and fit. And as you get older, you're going to need that because the body deteriorates way faster. Trust me.
Well, and I'm screwed. I'm screwed.
It's always a good time to get exercise going and build up muscle tone, because your body needs it as you age. Yeah.
Yeah, and don't keep taking that ibuprofen, Marguerite, because that causes bleeding.
See how she is? And then
Oh.
and then Patty will and then
No,
Patty will say
uterine bleeding, it
Marguerite.
helps with that. That's actually NSAID therapy is one of the treatments they use for heavy bleeding
Really?
because it reduces the blood flow.
How weird.
That's what NSAIDs do.
Oh, because
Marguerite,
mine, I can't take them for another,
did you have
for
did you have
another
other
reason.
questions?
I think you answered it. So basically just keep going at like as far as like when I'm like, shit, girl, you've been at this 3.5 years. Like just remind myself I got a lot of baggage from child. Stacy says I'm the most traumatized person he's ever worked with, and I hardly talk about my childhood with him. I can't stand it. He gets on to me all the time about it.
Yeah. And that's so I know it's hard to talk through. It's really difficult emotionally, but it's so important because that's where all of our belief systems come from. And
Off the
understanding
phone with
that,
him, I'm dizzy. I've had panic attacks on the phone
yeah,
with him.
yeah.
Yeah, that
And
timeline is big from your
Do I
childhood
just
too.
do I just
yeah,
power through it or what?
take it a bit at a time, but it is
Yep.
important. Even if you just try to understand where those beliefs come from and what healthy belief exchange would be is super helpful. I mean, you don't have to go back and completely forgive and all those things. I don't really believe in it's helpful, but I don't really believe in that. What I believe in is understanding where our belief systems come from, making the necessary changes so we adopt healthy beliefs, which then feeds into our, progress and underlying factors.
Yeah, because my therapist told me that she said because of your childhood, your belief system in that time frame, now you look at it as an adult,
Yeah.
and it changes the perspective,
So
and
changing
it
the
makes
narrative.
it right.
Yep.
It makes you actually see things differently as an adult, because a child, it's very confusing for a child.
Yeah. Yeah. We make
So
it up on
they're
the spot.
and
They
they
don't
get
know how to
stuck.
process as a
Right.
child.
Exactly.
You don't know how to process things properly.
Right.
And through all this with me, it has helped me in a way understand a lot because I've had anxiety since I was 9 because of traumatic, childhood stuff. And it has helped me realize now that I didn't realize all these years that I've been going and going and going with anxiety and the horrible symptoms, except for this one symptom that's a nightmare. I realized that as a child, I didn't have anybody take care of me, and
Yeah.
I had to take care of myself, and I had to make decisions for myself as a young child, and I even had to learn how to sign my mom's name on papers and stuff for school. And
Do you
so
think now
this
it's
is
hard
why,
to
well,
let people?
this is why I am a control freak. I've been a control freak all my life.
Oh my
I've had
God,
to
me
be
too.
in control of
Yeah.
everything, and everything had to be perfect
Perfect.
because my childhood after 9 was not perfect. So I had to make sure everything was perfect for my children. And I had to be the perfect wife, perfect mother, perfect daughter, perfect friend, perfect employee. And, I finally understood that this is what caused it. And so that helped me. That did help me.
So it does. It really does, Marguerite. If you can go back a little bit and start from, let's say, you work with Stacy, right?
Yeah,
And start from 0 to 10 and
no, I
go
wrote
through
it
that.
all out, but it
Yeah,
wasn't.
write that timeline
I
out
did. I wrote all that out,
and
but
work through each tiny little thing.
Yeah, we have to
with
do that with
him
Stacy right
so that you can, because I did that with my therapist after I couldn't see Stacy anymore. That was the very first thing she brought up. She said, I want you to do a 0 to 10 timeline.
Yeah.
And then I
I'll
want you
tell
to
that's
do a
hard
10
do.
to 20. And it's hard to do because
Oh God, my
it
symptoms
brings
spiked.
back so many bad things that you
It spiked.
believe were so bad. But
I
then when you
hated it.
start to look at it
Yeah.
as an adult, you can see it differently.
Yeah.
Or just understand that's
because
why.
I think one of the things is maybe I don't require people to treat me a certain way. Like, does that make sense? And I don't allow people to take care of me. Like my doctor, he really does baby me, and I've been pretty hard on him. I told you, Jim, I like screamed at him a lot. Okay, a lot. But I feel like I'm like when I leave, like when I left and I had all, and I started talking about the trauma and all the stuff about my lady bits and everything. And he's like, Marguerite, let me call your OBGYN. I will make a personal phone call. I will do that for you, all this kind of stuff. I left and I was shocked that he would do that for me.
Yeah.
No,
nice.
don't be shocked. He
And
wants
so
to
that
help
tells
you.
me like somehow I have stuff from a kid that I don't think anybody, even some of the nice things, Stacy's actually had done some nice things for me. I'm like blown away. Like, why would they do
Yeah.
that? Like, so
Yep.
that tells me, I don't know.
Yep. Yeah, there's underlying factors. Unfortunately, I'm gonna have to move on. I'm running out of time. And the reason
Yeah.
I have to cut it short is because I only have a limited sit time with my hip.